Hello, dear colleagues. It's Conversations About Hearing. My name is Aziz Topatullin, and let me introduce my today's guest. It's Professor Mridula Sharma. Professor Sharma is an academic and researcher at Flinders University. She is currently the academic lead for the Masters of Audiology course in the College of Nursing and Health Sciences. Her research centers on speech perception and noise, auditory processing, cortical, auditory evoked potentials, and auditory plasticity across age span. Dr. Mridula Sharma has investigated the effects of cognition, such as attention and statistical learning, on listening in populations with listening and hearing disorders. Hello, Professor Sharma.
Thank you. Thank you for the invite. And yeah, I look forward to having a chat with you.
Thank you for joining us today. And today we are talking about the auditory cortex. And my first question, in clinical practice, we have a big amount of children, like 2-4 years old, with speech delay referred for exclusion, some hearing problems. Can any components of cortical auditory evoked potentials play a role of markers of speech language development, like speech understanding, phoneme distinction?
That's a really very important question, I think, for pediatric audiology in general. A lot of work that's gone in so far with the pediatric population. We know we can assess their hearing very well, very easily. Apart from ABRs, we can use cortical responses, P1 response quite nicely to figure out, even if they're not participating, what is their auditory cortex receiving. But that talks about hearing. What we really want to know, as you said, is more about their language, right? So from that perspective, I think the next thing that we really need to evaluate is their auditory discrimination skills. That's fundamental. If you want to understand about a child's language development, etc., we don't want to know just that can they hear. We want to know, can they discriminate? And we can do ACC. We can use mismatch negativity, ACC being acoustic change complex. These are simple, quick to do, and we can do them in babies younger than 6 months of age. We published a paper with Suzanne Small from British Columbia, where we looked at ACC in infants, toddlers, and easy to do. They can be done. They must be done.
On the other hand, can cortical auditory evoked potentials in infants and toddlers be as a predictor of the future speech development? And if yes, which components of the corticals we should look at?
So actually, it was 1985 that Malfeas came out with a paper where they highlighted that auditory discrimination, early auditory discrimination skills can predict the child's language development. Now, if that is indeed true, then I think it goes that we should look at the baby's ability to discriminate between sounds and then see how that tracks with language. And Teresa Ching, Gary Rance, there was a recent paper and I was an author on it as well. We looked at that relationship in infants with hearing loss. And we looked at the presence and absence of acoustic change complex. And there were children with and without hearing loss, 3 to 6 months of age, and then 6 to a year later with their language and their parents' report. Now, that's just one paper, and there was a relationship. It was quite promising, but that's a very early paper. I think this is something that needs to be pursued. So if you're interested in this kind of research, it really must be evaluated further. So look at ACC, acoustic change complex.
Mridula, do we really need recording cortical auditory evoked potentials or other types of auditory evoked potentials in cases where a patient is quite cooperative and able to participate in behavioral testing, including speech audiometry? Again, when, for example, a child was referred to audiologist with speech delay, is there a strong correlation between corticals and psychoacoustic methods?
That's a very important and I think a really good question. And I'm not sure that there is enough data on that. I mean, we looked at, okay. So to answer your other question about the importance of corticals, behavior response is gold standard, but I think the cortical responses allow us to evaluate what's happening at the auditory cortex. So as a supplement to what the child is able to do, I think it's worth it. And with babies, again, we want to know about their percept, but we also want to know about their auditory discrimination. So looking at ACC is, I think it's worth it and worth pursuing.
But if, for example, a child can perform a speech audiometry, can perform a phoneme test, do we really need corticals in this case?
Yes and no. But because you're right, if the speech audiometry is there, we certainly know a lot more because that's gold standard, what a child is able to tell you. But the reason for doing corticals would not be to as a substitute, it would be complementary. And we would want to know in their auditory pathway what is happening at the cortical level, listening in noise. So you would change your tact to get more information. You wouldn't repeat speech audiometry, but you could look at, well, what if I challenge their auditory system by providing background noise? What's their response then? So you can use cortical response to get more information that supplements your behavior observation.
Professor Sharma, we all know a great study of your namesake from the United States, M Sharma, which provides us normative data of P1 latency for different ages.
Yeah.
Are there any other age-appropriate norms regarding cortical auditory evoked potentials we can rely on? Possibly amplitudes or morphology or other components?
Yeah. So Curtis Ponton, they had done all this paper, a lot of papers were published looking at age-related responses to P1, N1, P2. They even spoke about the different sources. And they looked at train of clicks because they were trying to find norms for, I think, cochlear implant populations. So they're a little older than even Anu Sharma's work. Then at National Acoustic Laboratories in Australia, there was a lot of work done to look at cortical responses in babies because they were looking at developing the Hear Lab to try and see babies with hearing loss, and efficacy of fitting a hearing aid appropriately, right? So those are available, but Interacoustics is now coming up with a module that looks at babies with their hearing loss and fitting of the device, which would mean that they have inbuilt norms that are available. So I would say that's certainly there, but you're also right that they're not enough. Like we don't have norms for ACC, for instance. But I think some of the cortical responses, and we can look at them as the person and their own norm. So you can follow what at different levels, what the response is like. Presence and absence is still the gold standard when it comes to cortical response. If there is no response, that's very informative. And we should ask, why is there no response?
And possibly the dynamics, right?
Absolutely. Yeah.
Which stimuli do you recommend using for cortical auditory evoked potentials for different purposes?
Well, I think you said it. They are different for different purposes. For example, when I'm looking at children who have listening problems, I'm looking at conversational speech because I want to know what is it that their cortical responses are to continuous speech. When I recommend babies with hearing loss, I want to know syllables because I'm trying to figure out where the responses are and where they're not. When I'm looking at school-age children with reading disorders, I'm looking at listening in noise. So I would look at syllables in noise, and now we are looking at conversation in noise. So it really is your question dependent and your population dependent. And corticals have right now, the number of signal processing and the amount of work that's going on, you can look at corticals to a syllable, to a word, to a sentence, connected speech, anything. It's dependent on your question.
By the way, what's your opinion about the new Manu Iru stimuli?
Sorry, which similar?
Manu Iru by Stone, which is used in interacoustics machine nowadays.
Oh, yeah, so I think they used the Mataga, that was the original NAL one, but then they've also added the new, which are a bit, which are slightly, I think, variant of the original sounds. I haven't really tried them yet, but I think there is some work that's been done. That's by Michael Stone, right? You said?
Yes, right.
Yeah, so there's some paper on those. So it'll be interesting to see. But see, it shouldn't matter because the question there is about percept.
Mhm.
So long as we know what the spectral response is, we should be comfortable in then seeing if we have a response, then which frequency response that corresponds to. So I believe they elicit, because of the nature of the stimuli, they elicit a sharper response, I believe. I'm not entirely sure. I don't see a problem in that.
Okay. So if we talk about clinical application of cortical auditory evoked potentials, we mostly mean P1 and 1 complex. Is there room
Yeah.
for other components like acoustically changed complex, mismatch negativity, P300 in clinic, taking into account time shortage, uncooperative children, and other technical problems?
Yeah. I think ACC certainly is very simple and straightforward. So we did it with toddlers, we did it with infants. So, and they're quick to do. Mismatch negativity is a very tiny response, the size of an ABR, but then, so you need a lot more averages and much slower response. Timing can be an issue. And one of the things we've discovered, or we've recently reported in one of the papers, is the test for mismatch negativity in clinical population wasn't so good. Normal population, much better. So it kind of has its limitations and requires a better signal processing skills. But ACC is much simple to use. So why not start with that? And certainly when you're looking at the question of auditory discrimination in babies with hearing loss, use that. I would highly recommend it because the little that we know at this point seems to suggest that early auditory discrimination skills might be useful for later and might be predictive of later language development. Something we should certainly look into. So I would certainly do that. P300 requires a little more attention, but might be useful for kids, older adults, kids, if we want to know what their discrimination is like with their devices, for example. We could, but would be very hard with children.
Can auditory evoked potentials help in diagnostics of central auditory processing disorders, autism spectrum disorders, attention deficit hyperactivity syndrome?
No, I don't think they're there yet in terms of diagnostics, but they are helpful in identifying where the problem may be. But I would not diagnose any of those disorders based only on cortical responses. Because we're still looking at cortical responses, we're looking at their amplitude, we're looking at their, well, latencies would not be that helpful. All right.
What can you say about the relationship between cortical auditory evoked potentials and cognitive functions?
It certainly is, it's so hard to separate them. So this is something like even with the right now when we are looking at cortical responses to connected speech, we're trying to evaluate the influence of language, attention, because attention, if you pay attention to a signal, your cortical response is bigger. I mean, that's how we discovered mismatch negativity from P300, Natanen and Picton's work way back in 70s. So it, cognitive function is certainly integrated in this process. So there is certainly something we need to be careful about. But to say that an absence of a response can be because of a number of things, and cognitive function may still be a part of it. So designing a good paradigm can make the difference and help us differentiate the effects.
Mridula, my next question about the late components, N400 and P600 and further. Do studies give us any promising data about them for the future application?
I think in audiology, these are very unexplored, like psychology and language sciences. They have used N400, P600. They look at sentences. They look at influence of accent on your in your processing. They look at when you're, I know a colleague of mine, Professor Catherine DeMuth, has been looking at the percept of "sir" as a plural marker in verb versus noun, and has found differences in children with hearing loss. So there is so much potential there. Again, it wouldn't be for diagnostic purposes, but it would be really informative about the child's language skills and their ability to learn language, or what are the possible issues or concerns that we should be addressing. So it really is, and of course, there's Picton's. He's highlighted the importance of N400, P600 in more cognitive disorders, like in schizophrenia, etc. So these are areas that really need exploring, and audiologists should be doing more.
Am I wrong if I say that the modern studies in electrophysiology and audiology become more and more about the EEG rather than just auditory evoked potentials? Researchers use multi-channel machines, complex analysis strategies. Do you think that the future clinical equipment will be more and more complex for performing methods that are more difficult?
I hope so, because it might make these techniques more accessible. There should be, because I think that is our limitation right now. I mean, more clinical tools allow us to, I mean, if you look at any clinical equipment, they give you a stimuli duration of 500 milliseconds. That's the best you can do. What are we going to learn with that? So we do need our manufacturers to start doing better signal processing, making it more accessible to clinicians so we can explore EEG, and yes, through different modalities. It shouldn't just be about auditory. It should really be about audiovisual, because everything is audiovisual these days. So there's so much more that needs to be done, and we do need to simplify some of this so that it is become more clinically viable and possible.
I know that you have investigated cortical auditory evoked potentials parameters in musicians. Do they have some specific characteristics? Can this method be a predictor of the musical talent of a child? Maybe this information is useful for parents who think about the music school for their child.
Yeah, you're right. It is an interest in all the parents, isn't it? They want to know. But all we can say is, yes, we found the difference, but is the difference because they learned music, or because there's something different about them and therefore they learned music? So it's a chicken and egg. We don't know what came first. But we did find some differences between professional musicians and non-musicians. We found children who were learning music. But again, we don't know what came first. Were they always different and therefore they got into music, or did the music make them different? I don't know. But nevertheless, music is such it is such a holistic, I mean, to quote my colleague Chi, he says music is such a multimodality, um, in a way, auditory visual training, right? It can't harm anyone. If you are interested in it, children are inclined, go for it. It certainly will be good, multimodality wise. Your attention would get better. Music means selective attention gets better. Memory improves. Your ability to holistically, listen to the rhythm, which helps with language. So there's just so many things that you learn when you pursue music. So I don't know if musicians are special, but music is special.
So that was very interesting conversation. Thank you for your time, and I'm absolutely sure that our listeners will be interested in our talk.
Thank you. I hope so too. And yeah, let's do more corticals. Let's find out more about what the children are hearing, what they're processing. There's so much we don't know, and so much we should be doing.
Thank you so much.
Cheers. Thank you for asking me.